Hello everyone, this is Dr. Kim, and I have another interesting case for you. This patient is in her mid-50s. Again, I emphasize the gender as well as the age, just because the quality of the bone and the ridge, size, and shape is very impressive in my opinion. This patient was scanned for a dental implant at site number 3. So as you can see from this axial view, the tooth, this area is edentulous, and the socket, you can vaguely see the outline, mesiobuccal, distal buccal, and palatal. The sockets are fully filled and healed at this point with either bone or graft material. You do also see some fragments of dense radial opacities, most likely representing restorative material, in this case, some type of either gutta percha or sealants. Anyway, this area is healed and ready for a dental implant. It really wasn't apparent to me until I made the cross sections and start making the measurements that this ridge is unusually wide and tall. So let's go to the cross-sectional images. Here we're looking at cross-sectional images that are made using 2mm interval. So as I move from here to here, you can see the corresponding slides from this reconstructed panoramic radiograph as well as the axial view. You can see that white line is moving toward mesially. So here's a mesial aspect, here's a distal aspect, each slice separated by 2mm interval. So now, this is the buccal cortex, alveolar crest, and palatal cortical plate, and this is the maxillary sinus, and now we're looking into the nasal cavity, specifically this being a part of the inferior turbinate. I'm not sure how well these numbers will show up, but the width of the ridge measures anywhere from 16 to 13, very impressive number as we go toward distally. And even the height of the ridge measures from this 3 sectional images from 16 millimeters to 18 millimeter. And based on my experience, this is very, very impressive. The height of the ridge is unusually tall in the posterior maxilla. Every once in a while, I do get a number that can be relatively tall, 14 or 15 millimeters in the posterior mandible, but I don't generally get this type of number in the posterior maxilla, largely because of the presence of maxillary sinus. A lot of times the sinus would pneumatize and grow inferiorly so that the ridge height is relatively short in many cases. But again, that 16 is extremely high in my opinion. And again, here, which is closer to the center of the ridge, the edentulous ridge, height being 18 millimeter is very, very impressive. And that is even more surprising, the fact that this is a scan from a female patient. Again, the bone quality is nice and great. The ridge is very wide. You'll have no problem placing just about any implant that you choose. In this case, just as a demonstration, I have placed a virtual implant that measures 5 millimeter by 10 millimeter. So the width of the implant is 5 millimeter. And you can see, this is relatively wide. You can obviously find the wider implant that is 6 millimeter. But at 5 millimeter, you have more than enough bone buccolingually. And of course, the height is very generous as well. So I just wanted to share with you a ridge that is unusually wide and unusually tall for a patient, for any patient, for that matter, in the posterior maxilla. So that's all I wanted to share, and perhaps if I move my cross-sectional image a little bit more mesially, you can see that the ridge does become more narrower when we get to the area of tooth number 4, which is what we normally expect as well. But again, let's see how tall this ridge measures. And this again is 19.8, very, very tall. Anyway, that's all I wanted to share, and I hope you found this video helpful, and continue to watch my future videos, and please subscribe. Thank you very much, and take care.